tunnel, also called the median nerve compression, is a condition that causes numbness, tingling, or weakness in your hand. It happens because of pressure on your median nerve, which runs the length of your arm, goes through a passage in your wrist called the carpal tunnel, and ends in your hand. The median controls the movement and feeling of your thumb and the movement of all your fingers except the pinky. The carpal tunnel is a narrow passageway surrounded by bones and ligaments on the palm side of the hand. When the median nerve is compressed, symptoms can include numbness, tingling, and weakness in the hand and arm. Today on your regular Health TV Talk Show, the physicians will be discussing the carpal tunnel syndrome, the causes, the symptoms, management, and of course, diagnosis. We'll be back after the short break. Stay tuned. It's another day with the physicians where your health is our business. It's always a delight having you as our audience watching and waiting weekly to your regular Health TV Talk Show, The Physicians. My name is Dr. Martina Agbere, one of your anchors on this program. And as usual, I'm not alone. I have my co-host.
I'm Dr. Memuna Yusuf Kadri, and of course, it's always a pleasure to be on this regular Health TV Talk Show, where your health is our business.
So we're going to be talking about the carpal tunnel syndrome. Don't bother about the name, carpal tunnel. By the time the consultant comes, he's going to actually break it down so you understand it. Carpal tunnel, and then the syndrome. Ducky, we're going to talk about carpal tunnel syndrome.
Have you should not worry about the name. You should worry about the name. Because if you're telling me carpal tunnel syndrome, the first that comes to my head is like, what is it about the tunnel? Why is it called carpal?
And a syndrome.
Why is it a syndrome? You know, so yes, why would you as our amazing audience don't worry about the name, because we're having somebody come on set to come and talk about it. Yes, I've had cases of carpal tunnel. It's not so, of course, in medical school days, it's not like it was a regular thing, but I've had a woman who was pregnant. I think there was a correlation between her pregnancy and the discovery. Yeah. And, you know, it was a major case study for me then, because it was, I was just young in med school. I know they may sound like this is a serious medical condition, but you is like, this is an interesting
one, yes.
case. And that was my very first carpal tunnel syndrome. And why it was interesting, because, you know, when you are learning something in practical,
and you're seeing it,
and you are seeing it, it's like more execute, and you can then really get the full picture of what it is, you know, and, you know, when you talk about the risk factors, does this person fit in? Does this person, you know, have anything that's causing it? So for me, I think that was
Is that what you say is it just a textbook stuff?
It's not exactly.
In textbook, and you don't have to read. Let me talk about carpal tunnel syndrome, the disease of the hand that has to do with the hands. Okay? So
the hands are not opening very well.
So it's not any other part of the body, it just had to do with the hands. We have a guest that is going to come and talk more about carpal tunnel syndrome. Those tingling sensations that you have, the numbness. Do you think you have a carpal tunnel syndrome? We'll be back after the short break. Stay tuned. Welcome back. If you have just joined us here on your regular program, The Physicians, where your health is our business and will always remain our business. Today we'll be talking about carpal tunnel syndrome, the causes, the symptoms, diagnosis, and of course, management. And in the studio, may we have our guest. He is a consultant orthopedic surgeon with the CEDARCREST hospitals. He is Dr. Bolarinwa Akinola. He is actually the physician's doctor. Welcome to our program.
Thank you very much, Dr. Agbere. Thank you, Dr. Kadri.
Welcome, Dr. Akinola.
You're looking good in your scrub, something different.
Yeah, I just wanted to show my work side a little bit.
Yeah, that's really good.
Not every time suit and buba and all of that.
We love it. So we're going to talk about carpal tunnel syndrome.
Yes.
Maybe if you give us an overview where this actually starts.
Essentially, the carpal tunnel syndrome. So things are called a syndrome when you have a number of features coming together that is consistent and that almost everyone that has the problem manifests when they have the problem. So that's where the syndrome idea comes from.
Okay.
But essentially, it's a problem involving a nerve in the body, in the hand specifically, called the median nerve. And that condition is such that, so the carpal tunnel is a name for a bony architecture, like you said, around the wrist, around the palmar surface of the wrist. It's surrounded by bone, by tendons, by ligament, and then within that architecture, within that space, there is the median nerve that runs from the forearm and goes into the hand to supply the muscles of the hand. So because sometimes the median nerve can get compressed within that space that is called the carpal tunnel, that's where the name carpal tunnel syndrome comes from. So this nerve runs within this tunnel gets called carpal tunnel, and then when you now start having symptoms of the compression, it's now called the carpal tunnel syndrome.
Okay.
So that's where the name comes from.
Okay.
Yeah.
So what do we look out for? What are those early signs, symptoms? Like
Hand conditions are actually very common. Now, the problem is a lot of people find a way to cope and they find a way to manage as long as it hasn't, because your hand, unless it's your dominant hand, the hand that you use for everything, many people will not present to the hospital as long as they can still keep using the hand. It's only when it becomes so debilitating, so difficult, so serious, that's when they now decide to seek advice. And sometimes at that stage, it's a bit too late, to be honest. However, coming specifically to carpal tunnel syndrome, the key thing to mention is a lot of the symptoms you get affect mostly the thumb, the index finger, the middle finger, and sometimes the ring finger. It almost never affects the little finger. And one of the earliest signs people get is pain. They just have this pain in these fingers specifically, and it's usually around the palmar aspect, the palmar surface of these fingers. That's where they tend to get the pain. So they get this pain and they get tingling as well. So pain and tingling is often a very common feature of carpal tunnel. Some people initially only get it at night. So when they go to sleep, they get it at night as they're going off to sleep. Some people get the tingling, especially when they wake up in the mornings. They wake up in the mornings and then the numbness also comes in. So you have the pain, you have the tingling, you have the numbness. And some people wake up in the morning, it's as though their hand has gone dead. And they have to shake it and shake it and shake it before it comes alive again. So, and they're like, oh, it's a vein or something. A lot of people use all these expressions. Yes. So those are the common symptoms syndrome. Over time, as the problem progresses, then it can lead to weakness. Because let's not forget that these nerves, they supply muscles. And the muscles allow the hands to function. Yeah. And once the nerve gets so squashed that it's not functioning anymore, the muscles start to die off, and then the function of those muscles are not there anymore. And so people now realize that they start dropping things. You're holding on to something, you go to the kitchen to cook, maybe you're holding the spoon to turn something, you just walk from the shelf to the cooker and then the thing has dropped, and like, how did it drop? So because your grip is not as strong anymore, the muscles supplied by the median nerve is not as, they're not as strong anymore, so the weakness comes. But the weakness is a late sign. Usually by the time you're getting to the stage of weakness, you've waited for too long, usually.
Okay, so you already talked about it affecting the thumb,
yes,
the index finger, the middle, and the part of the ring finger.
Yes.
I think does it have to do, maybe they need to understand that it has to do with the nerve supply to that region?
Absolutely.
Why the pinky is not affected?
Absolutely.
Then what causes the compression?
Good. So, yes, you're very correct, Dr. Agberian. It's because the median nerve doesn't supply the little finger. The little finger is supplied by another nerve called the ulnar nerve. In fact, the median nerve typically supplies half of the ring finger. So that's why people feel some pain on the ring finger. The other half of the ring finger is supplied by the ulnar nerve. So there's this common saying of 3.5 fingers supplied by the median nerve and 1.5 supplied by the ulnar nerve. So the first thing I'm quickly going to say before I go to the causes of carpal tunnel is The reason why it's important for people to present early, to be seen when they start feeling these symptoms, is that even though one of the commonest reasons why people have these symptoms is the carpal tunnel syndrome, it may also be something else. Because every nerve that supplies our muscles start their journey from the neck at some point. They travel from the neck down to the shoulder, down to the elbow, down to the forearm, before they end up in the wrist. And as they travel down, some of them give off branches to different muscles as they are coming down all the way from the neck. So the problem you're feeling in your hand may not be coming from the wrist. It may be coming from the forearm, it may be coming from the elbow, it may be coming from the shoulder, it may be coming from the neck. So it is the way you present and the tests, some of the tests that the doctors do, that will help them to localize better where this pain is coming from or where these problems are coming from. But specifically for carpal tunnel syndrome, we know that that is coming from the wrist. But I just want to leave a word out there that just in case there's anybody having these symptoms, please see somebody, so that in case the problem is coming from a higher level, that can be picked up on time.
The referred pain.
Exactly. It could be referred pain. So in terms of the causes, so again, like many things in orthopedics, you can't point to a definite cause. But we know that there are things associated with carpal tunnel syndrome. One of them is something that Dr. Kadiri mentioned, which is pregnancy. We know that some conditions that cause increased swelling. So what is the whole thing? The carpal tunnel space is a small space. So anything that allows it to either swell up or reduce in space can potentially cause carpal tunnel syndrome. Pregnancy is a condition where things swell up.
Yeah.
You have a lot of swelling in different parts of the body. And so that swelling can cause carpal tunnel syndrome, because it's one of the areas that gets affected, because the carpal tunnel is a small space.
Yeah.
But the good thing about pregnancy-associated carpal tunnel is it tends to get better after delivery. So most people with pregnancy-induced carpal tunnel syndrome, it won't continue after delivery. For a few of them it will, but for most people it wouldn't. From the anatomy perspective, some people have smaller carpal tunnels than other people. So those people will definitely be predisposed to having carpal tunnel syndrome. If you have a fracture around the wrist, or you have a dislocation around the wrist, just because you've now crowded that space much more than before you had the injury, that could predispose to carpal tunnel syndrome. Women are more commonly affected.
Why?
And the reason we think for that is because they have smaller carpal tunnel spaces than men.
Oh, really?
Yes, absolutely.
Is there any way it can be expanded? Yes, I need to just know that.
It's a bony tunnel. So there's
Can you imagine
there's
that?
no
That is
the
like double
exercises?
jeopardy.
no
Smaller carpal tunnel and pregnancy.
Exactly.
Has weight got anything to do with it also?
Obesity definitely is a risk factor for carpal tunnel.
Being a woman and you're obese?
Exactly. So double.
Wow.
And in fact, it's been found that being a woman, the women who get affected by carpal tunnel, their spaces tend to be even smaller than women who are not affected by carpal tunnel. So that the space itself, it's something to think about. So the medical conditions that can predispose are things that can generally increase swelling, things like rheumatoid arthritis, inflammation. If you think about inflammatory disease, you know the soft tissues can have inflammation, get swollen. If it happens around the carpal tunnel, that can crowd the space, and that can lead to compression of the median nerve. Diabetes, because diabetes affects nerves generally, so people are more predisposed to carpal tunnel syndrome if they have diabetes. Thyroid problems, kidney problems, those can affect the carpal tunnel space and predispose. Also occupation. So it's been shown that people who use vibrating tools, you know, all these roadworks where the things are vibrating.
So then the men will be affected.
Yeah, so males get affected as well. It's not as if males don't get affected at all. So it's not a female disease. Men do get affected, but women get affected more than men. So vibrating tools, people who do repetitive wrist movements, so people who type a lot, and you know most secretaries tend to be women. So a lot of those repetitive movements. So anything that causes flexion, extension repetitively. So these are things that are associated. So they're not completely causative, because if you look, if you take
just
100
risk
people
factors.
that do those things,
Yes,
not
mainly
everybody
risk.
will have it.
Yeah.
But those are some
They're
of the
more
risk
of risk
factors that we
Okay.
have identified with carpal tunnel.
She has gone
Okay, so
far.
with that, maybe you want to talk about how do you want to fix a patient who has a carpal tunnel syndrome?
Great. So first thing, as always, first thing in medicine, take a proper history, make a diagnosis. So we have to take a proper history, we have to make the diagnosis. And how do we make the diagnosis? A lot of the diagnosis is obvious from the questions you ask patients and from the symptoms they present with. But sometimes, in order to make sure that you're not missing anything, you may want to do x-rays sometimes of the wrist to make sure that there's nothing else you're missing out. You may want to look at upper levels, as I discussed. If you think that there's, oh, maybe this is not coming from the wrist, even though it looks like carpal tunnel, maybe it's coming from somewhere else, you may want to do that. But the classical investigation to confirm carpal tunnel syndrome is what is called a nerve conduction study. And the nerve conduction study is where they use a special machine. It's done by neurophysiologists. Unfortunately, we don't have many of such in Nigeria. Off the top of my head, I only know of one place right now where this test is done.
Really?
But I'm sure there may be others that I'm not aware of. So you kind of stick needles at different points, and then you stimulate the nerve, and then you check the readings to see whether there's some impaired reading or not. And that can go hand in hand with what is called electromyography, especially if you think you've got weakness. So once you've made a diagnosis and you're sure that the patient has got carpal tunnel syndrome, then you now have to treat. And treatment always falls into non-surgical and surgical treatment. And some of those non-surgical treatments is you give them a splint, a wrist splint to wear. You can give them non-steroidal anti-inflammatory drugs like ibuprofen. That could ease because, again, it's an anti-inflammatory. And sometimes we give corticosteroid injections as well. So when the disease is still in the mild or moderate situation, those can help and those can work. But once the disease becomes much more troubling, much more debilitating, then surgery becomes the option of choice. And what we do is called a carpal tunnel decompression. We simply make a cut over the region of the carpal tunnel, open it up, and free. There's usually a covering over the carpal tunnel itself. Yeah, a very thick fascia. It's called the fascia. We release that fascia and release the median nerve. And once the median nerve is released, the symptoms will get better. Actually, it's a 10-minute operation. It doesn't take time at all.
Maybe before you talk about the complication, we need to go out there and keep a date with the physicians because people are actually there. A lot of people want to talk about it. So let's hear what you have to say about carpal tunnel syndrome.
Hi everybody, my name is Kennedy Olugore, aka Papa K. I'm a music producer, sound engineer, studio engineer, a music instructor, keyboardist. I play a little bit of almost some of all the instruments. Okay, what carpal tunnel syndrome is something that affects people like me who do music studio. It starts with tingling in the fingertips, and also the wrists. You start having some funny feelings in your wrists, and it's something that is common with people in my field. So that's what carpal tunnel syndrome, I think it is. Okay, one of the ways to prevent carpal tunnel syndrome is not putting too much pressure when you're using your hands, whatever tools you're using, and also using the eyes. I mean, putting your hands in the eyes, sometimes it will also help you to reduce the effects of the syndrome. So it's one of the things that helps you. And also taking enough nap, enough rest is one of the things that we're having issues with as music producers. A lot of time we work so hard and we do not consider our health. These are the things that actually can help to minimize the effects of the syndrome.
In the studio is our consultant orthopedic surgeon, Dr. Bolarinwa Akinola, of the CEDARCREST Hospital here in Lagos. Dr. Bolarinwa, you've been doing justice to this program. And before we went to a break, well, actually, Dr. Bolarinwa was asking about the complications.
Though we know that there will be complications, but how bad could these complications be? because we know here on the physicians, we are preaching prevention. So those that be doing things differently before they come for that 10 minutes operation.
So you mean complications of surgery?
Of the surgery,
Oh,
yeah.
great. So thankfully, complications, as I said, if you're doing everything as it should be done, complications are pretty few. Of course, there's a potential that you could damage the nerve in the course of releasing the nerve, but there are ways to protect the nerve so you don't damage it. So it comes with part of your training. One of the commonest complications is incomplete release.
Okay.
Incomplete decompression of the nerve. So if you haven't fully decompressed the nerve up and down the carpal tunnel, then the symptoms may be relieved for some time and then come back again. So that's why sometimes just making sure that you do a proper job and you do it completely. Even in the best of hands, sometimes it happens that you don't you have a few strands of fascia left that you haven't fully decompressed, and then that could cause a further compression in the future. So apart from that, it's a pretty much straightforward operation. Yes.
So apart from this complication, we already know that it affects the females more than the males.
Yes.
Has age got anything to do with it too?
And so for many of these conditions, usually by the time you're getting to over the age of 50, they become more common. And don't also forget that some of the other associated conditions that we mentioned are also getting, apart from pregnancy, of course, are also getting more common with advancing age. You know, the diabetes, the complications are beginning to show more, all the other medical comorbidities. So, but yeah, I would say from about the 50s and above, more people tend to present at about that age. But as it is, anybody can present at any time with carpal tunnel syndrome symptoms, definitely.
So thank you very much, Dr. Bolarinwa, for coming to our program, The Physicians. It's been a great pleasure having you again. Each time we called, you always honored our invitation. I really appreciate you, and I'm sure our viewers out there will always look forward to having Dr. Akinola as our guest. We really appreciate it, and we say thank you so much. We've talked so much about carpal tunnel syndrome, and I'm sure our people out there we really know that carpal tunnel syndrome is what they should also, if they have pain, they have tingling sensation, they should see their doctor. Thank you so much. And for our viewers out there, I'm sure you actually had a real ball this day. Listen to what Dr. Akinola talked about carpal tunnel syndrome. So if you have pain, weakness, numbness, don't forget to see your doctor. Maybe it's not even carpal tunnel syndrome, because from what he said, it could be a referred pain from the neck, the shoulder, down to your hand. Don't take anything with levity. My name remains Dr. Martina Agberie. Till next time, stay blessed.
Thank you very much, Dr. Akinola. It's always a pleasure having you. And we get schooled anytime you come in. And it's always exciting, the knowledge that you share. Thank you very much.
Thank you so much.
To all our viewers out there, you've heard about a new word today, carpal tunnel syndrome. If you've never heard about it, you know, this is the time to even go and get more knowledge. But know that women, sadly, I'm a woman, I'm part of the statistics. Women tend to have it more than men because we have the carpal tunnel in women is also a bit smaller than those of men. Then women, the reproductive age group, pregnancy could be a risk factor. It's not like it's always, but it could be a risk factor. Then occupationally, those that type more and people that use machines that, you know, that vibrate. So now you have heard all of these today. Try as much as possible to educate yourself, educate the people around you when you have the pain, numbness, tingling sensation. Don't just take painkillers. Seeing a doctor could do you a whole lot, at least. One thing I know it will help you do to make you not to enter the theater for 10 minutes where the surgery is done. For every time we are here, we really, really do appreciate you, but please don't forget to follow us on all our various social media platforms. Our YouTube is there. Previous episodes are there for you to binge on. It's holiday period. Please go binge on all these episodes and get schooled and be more aware about your health. Facebook, Twitter, Instagram, there are also platforms you could also follow us on. My name remains Dr. Memuna Yusuf Kadri. Until next time, remain blessed. The one that we can use to break into your account.
Which can break?
We have to know.
Ah, no.
Right.
Which can break into this thing? Now when be say you can't even withdraw more than how much? Any person you can't withdraw more than how much?
But it's a good thing now.
But how are you there? Hello, welcome. Bon, just finish. Thank you.
Let's remove our.
Are you signed? If 1 is on, if 1 o'clock is on, are you sure you still can sign? My mic, I remove it for me.
Go there a little. Okay. You are doing it again. When is it? Let us know. He said he says to see. Just go ahead. Come on, hold the glass. Come on, hold this glass. Sorry, I tried to see. You just want to see your face. Don't sign it. So that's why you're trying to.